Naka colleagues, thank you so much for your patience. My name is Prashika Nathan, and I'm from the PG National Disaster Management Office. I have the pleasure to be your facilitator for today's webinar. I would like to thank you all for making time this afternoon to join us for this important webinar for launching the report on disasters and public health emergencies in the Pacific. Just before we start the webinar proper, I would like to share some housekeeping matters. Please be reminded to turn off your mic if you are not speaking. Please do raise your hands if you would like to ask a question or put your questions in the chat box, which will be monitored by our team. If you are able to, please do on your cameras when speaking. Without any further ado, I would now like to invite the Director for PG NDMO, Ms. Vasiti Soko, to deliver the opening remarks before we give over the floor to our panelists to speak. Over to you, Madam Director.
Thank you, Prashika. I'll start off by sharing some of the experiences that we have faced in a context where we had COVID as well. In April 2020, Fiji was hit by Tropical Cyclone Harold, and at the same time, we had our first case of COVID-19. Like many other countries in the world, this gave rise to several issues that complicated our response operation, such as the limitation to the number of people gathering, social distancing requirements, and curfews. And I need to make mention that when we were responding to TC Harold, those that were planning this response were in the lockdown zone area, while those that were executing this response plan were outside the lockdown zone area. And so the communications were very essential at that point in time. But also at the same time, I'd like to further enhance further stress the importance of existing emergency structures that has, pushed the agenda forward on having the response, mitigated in a way that it was done, but at the same time ensuring that we do not take COVID to our maritime islands. COVID-19 has accentuated the need to strengthen the harmonization of our laws and regulations to ensure a strong multi-hazard coordination approach that sets out clear roles and responsibilities for DRM implementation at the national level, which also mean the best international practices for the international public health regulations, the Bangkok principles, the Sendai framework, as well as the Paris Agreement. Existing national disaster risk management structures, I had said earlier, that countries have invested heavily in and have been tried and tested during responses to other disasters should be strengthened to cater for emerging disasters or emergencies, including pandemic. The harmonization of these structures is essential because introducing multi-sets of parallel structures will not only be costly, but also confusing and counterproductive. In any disasters or emergency, there are certain constraints that will always be present. At the center of these constraints are the impacted people and the assistance that they require, including psychological support, first aid, medicine, logistic support, wash facility, shelter evacuation center in the case of an outbreak, quarantine support during the emergency response phase, the early recovery phase, and the long-term recovery phase. To cater for these emergency phases, a whole of society coordination approach is required. This coordination engagement requires NDMO leadership and the management, as this is NDMO's area of expertise, from preparedness up to when long-term recovery kicks in, where operations will then be part of the Ministry of Economy and other sectorial ministries to take form under their normal mandates. With emergency of critical importance of DRR and climate change, we find that these considerations must be factored into the response and recovery planning through the preparedness stage. A constant here for all hazard is the need for an accurate risk-informed data or information. In drafting the next of our new disaster risk management bill, we are taking a multi-hazard or risk approach and a whole of society, people-centered approach. We hope to introduce risk governance at the links across the international to national and subnational level, right down to community. Whereas we understand that there are other hazards managed by other risk managements, example, health, biosecurity, environment, fire stations, aviation, and maritime, we hope to create linkages where we can support them during emergencies in their respective mandates just as they support NDMO when natural disaster declaration is in place. At the regional level, Fiji NDMO is the deputy co-chair of the FRDP Pacific Risk Governance Technical Working Group. The FRDP is the Pacific Integrated Approach to Coherence, both in climate change and disaster risk management. It has three main goals. That is to strengthen the integration and adaptation of both risk reduction to enhance climate change and disaster, low carbon development, and strengthen disaster preparedness, response, and recovery. The TWG brings together Attorney General Office, legislative drafters, and NDMO or NEMO's director from around the region for a peer-to-peer support and sharing. The deliverables of the technical working group includes the publishing of a study on regulation of international assistance law for 18 Pacific Island countries with regional recommendations, and the assistance of the IFRC have also undertaken to do a regional public health emergency study for 8 island countries. With that, I now open the webinar this afternoon. Thank you, Prashika.
Thank you, Director, for your opening remarks. We are indeed very privileged to have with us today panelists across from both the national and international level. I now have the pleasure to introduce our panelists this afternoon. We have Ms. Finau Leveni, Head of International Programs at Caritas Aotearoa and co-author of this report. We have joining us Mr. John Hopkins, Professor of Law and Director, Institute of Law, Emergencies and Disasters, Law School, University of Canterbury. We also have joining us Ms. Tala Mawala, Secretary General of Samoa Red Cross. We have Ms. Gabrielle Emery, Gabby, the Head of UNDRR Pacific Sub-Regional Office. We also have joining us Mr. Tusi Pinikaso, Policy Officer for Tuvalu NDMO. And we also have Ms. Sayana Rocco-Vudago, IFRC Partnerships and Program Manager. Without any further ado, colleagues, I will move on to our first panelist. We note that Ms. Finau sends her apologies. She's not able to join us live today, but she has provided a pre-recorded intervention. Please allow me to very briefly introduce her before we give the floor to the Secretariat team to play the pre-recorded video. Ms. Leveni heads the international programs team at Caritas New Zealand. For the past 20 years, she has walked across the Pacific, Asia, and Europe, both the International Federation of Red Cross and as a diplomat for the Tongan Foreign Ministry. She is very passionate about elevating Indigenous voices in aid and development. She is an international disaster law consultant and a founding member of the Pacific Koloa Collective, a New Zealand-based think tank for Indigenous Maori and Pacific aid and development practitioners. I would like to now request the Secretariat to please play her pre-recorded remarks in relation to the findings of the study on regional cooperation and recommendations for the next steps. Over to you, Secretariat.
Kore ke o hufanga e he whakatapu ko osi no au whakikai a tāmo ki whaki wahe no maloi le ni sambula vinaka tina koutou katoa. It's wonderful to be here, and I thank you all for the opportunity to share this platform with some heavyweights from the region in this area. I acknowledge you all, and I recognise that I'm standing amongst giants. My name is Finau Leveni, and I was one of the researchers for the Disaster and Public Health in the Pacific publication. It really was a fascinating exercise undertaking this research, and as a Pacific person, it was really incredible to see the things that globally we're leading on in terms of innovation and adaptability, but also to see the areas that need strengthening and that we actually can improve on. I'm going to leave this part to my colleague John to share with you our some of our key findings, some of the challenges from the report. For my part, I thought I would focus a bit on the regional frameworks and the mechanisms, particularly around the recommendation for the further development and the formalisation of a regionally led disaster and public health cooperation mechanism under the Boe Declaration. The Pacific had a really fantastic regional response to COVID-19 through the Pacific humanitarian pathway. And if we look at why it worked so well, you can see that the groundwork for this had already been laid out long before the establishment of the Pacific humanitarian pathway, or the PHP. We see things starting to take shape through the 2018 Boe Declaration, and this expanded the region's concept and notion, definition of security. In 2019, we see the Boe Declaration Action Plan, which provided a framework for implementation. Importantly, what it also did was include a pledge to develop a regional coordination mechanism for disaster response, disaster preparedness and response. And this again coincides with the establishment of the PRP, or the Pacific Resilience Partnership, and this was a mechanism for civil society and multi-stakeholder cooperation across the region to support the implementation of the Framework for Resilient Development in the Pacific, or the FRDP. So we're seeing all of these regional initiatives kind of culminating in the creation of the Pacific Humanitarian Pathway. Now, this is a Pacific-led initiative that provided a single mechanism to facilitate member requests for assistance. One of the key things that it did was develop a set of high-level protocols to facilitate requests for humanitarian assistance. And again, this was another fulfillment of the Boe Declaration. So in terms of this resounding success and lessons learned and next steps, my reflections would be, let's not stop here. How do we turn the Pacific Humanitarian Partnership for COVID-19 into a Pacific Humanitarian Partnership for all hazards, whether it's COVID, whether it's the measles, whether it's a cyclone, a flood, a tsunami? What talanoa do we need to be having? With whom? What frameworks need to be developed to enable this? Through the PHP, the Pacific Humanitarian Pathway, we have a really tangible example of effective regionally managed disaster response. So my question would be, how do we then leverage off this success and build a robust regional framework for a robust regional response mechanism? I probably leave it there and give my colleagues and other panelists an opportunity to speak. But thank you for letting me share my thoughts and my reflections. Malo Albedo.
Thank you very much, Pinau. That is indeed an interesting question, which we hope we will continue to motivate us to progress a regional response to disasters and emergencies in the Pacific. What next? We understand that our colleagues in SPC and PIPS are currently looking at this question. This would actually be a good setup question for another webinar focused on the next steps beyond the Pacific humanitarian pathway for COVID-19. What the future of regional risk governance and response to disaster or emergencies look like in the Pacific. Coming back to our study, next I will give the floor to Professor Hopkins, who will speak on some of the challenges for the study, the key findings and recommendations. Mr. Hopkins is a professor of comparative public law who specializes in disaster law and governance. He is the director of the Institute of Law, Emergencies and Disasters at the University of Canterbury Law School and is a team leader for HUECO, the Hiranga I hope I'm pronouncing this properly, which means this NZ Center for Earthquake Resilience. His work in the field of disaster law has included European Union, IFRC, and National Science Challenge, NZ-founded projects examining regional and national approaches to disaster law in the Asia, Pacific, and Europe. Professor, the floor is yours.
Kia ora koutou. Thank you very much for the kind introduction. Ahi ahi. Firstly, just to acknowledge my very thanks for the opportunity to speak today to the panel, and to acknowledge the privilege I have of speaking alongside. So I am very glad of the invitation. Thank you very much. So as you just heard, Dr. John Hopkins Tene, I'm a professor of law here at Otahi Christchurch, and I work in the field of law and disasters. But my reason for speaking today is because alongside Finau Laveni, who you've just heard from, we were the lead authors of the Law, Disasters and Public Emergencies in the Pacific report, published by the IFRC and being launched today. In passing, I also need to mention that this was a team effort. Finau and I led a team of researchers and research associates, many of which were students here at Christchurch, and we're really indebted to them. Particularly good to see some Pacific Island students participating in the work. So the report that's being launched today is the culmination of work that was undertaken in 2020 and 2021, examining the interaction of public health, emergency, and other disaster law frameworks across 8 Pacific states, and also slightly more generally across the region as a whole, and providing some assessment of regional responses as well. The report that's being launched today is the culmination or the distillation of a much larger report, which is over 120 pages long, looking at these national and regional response frameworks on a national and regional basis. So what you see before you is being launched today is a sort of summary of that work. But a little note in passing to say that the research was undertaken in 2020, or over 2020, 2021, so it reflects the state of play at that point. Since that time, of course, many of the countries studied have now experienced COVID outbreaks themselves. At the time, few in the Pacific had. Of course, unfortunately, we've seen COVID outbreaks across the Pacific in our communities. And that has put the public health emergency and the wider disaster law legal framework to the test in a way that hadn't quite occurred when we undertook this report. So we can't comment on the detail of those, but we would say that from what we know since, we wouldn't change the recommendations, and we think our views are still valid given the change in circumstance. And it would certainly be worth revisiting some of the questions posed in this report once we get a full view of how the COVID pandemic and its management in relation to public health emergencies has passed. So there's a few things we found, quite a few. I'm not going to be able to get through them all, so I'm going to focus on some key issues. The first thing I think I would say is that much to echo Finau's comments, that much of what was achieved in the Pacific was impressive and deserves recognition beyond the region. We'll return to this briefly in a minute, but certainly the coordination levels were higher in our experience than we're seen in some other more developed parts of the world. Part of the regional success, part of the Pacific success was in regional cooperation. However, I'm not going to comment on that. You've heard Finau's comments already, and we can maybe discuss that later. For issues of time, therefore, I'm going to focus on domestic issues within the states that we examined. So the first point to point out is that the ability to keep the region COVID-free, or at least at bay, for the best part of 2 years across the Pacific region was not inevitable, despite the fact that external actors often make this claim. This was a policy decision, and it was achieved by the actions of Pacific Island states. But those actions, of course, created significant challenges for the states concerned. For most Pacific Island states, as a consequence, the disaster has not been a health one. Of course, that has changed more recently, but in fact more of an economic and social disaster. Those links with the outside world were severed, creating fundamental problems for the economies and the populations of those states. So this created a problem experienced in much of the world, whereby although health agencies often led the COVID response, as they do public health emergency responses generally, they often didn't have the legal tools and experience to effectively do so. The legal gaps are particularly obvious in a number of states that we studied, and I should say these gaps are common globally, and perhaps we'll hear later about the IFRC's global studies, where the public health emergency legislation was insufficient to deal with a modern pandemic. In the Pacific case, this is partly due to the age of a number of the public health acts or sections within health acts where they existed, but also the tendency even of more modern acts to treat health as a special form of disaster with limited connection to the wider disaster law legal framework. These legal gaps were generally filled by the use of emergency powers in Pacific states, often for long periods of time. In addition, new acts or statutory amendments were passed, which have proved problematic and at times controversial. The lesson domestically, therefore, is that most Pacific Island states did well, but the lack of integration between Pacific health emergency and disaster law frameworks created an obstacle to a coherent response and an overuse of emergency powers. In some cases, some of those, the worst excesses of that siloization between the health emergency and disaster law frameworks was resolved by informal relationships between the two sectors in the Pacific Island states, but that informality didn't always work. And in any case, you're sort of relying on personal relationships, which might not always be there. So in terms of the recommendations that we think that Pacific Island states should consider, and indeed some of these recommendations would certainly apply more broadly, the COVID pandemic showed the need for the existence of disaster law frameworks, which we've already heard, that incorporate health and allow for a joined up response with the NDMO at its heart, not seeing the National Disaster Management Organizations as a something alongside a health response, but actually in the core of all disaster responses, even including health. And that the way to do that obviously is to utilize the principles found in the Bangkok Principles, which again we might hear about later. Such frameworks need to be streamlined, they need to be easy to follow, and they need to be focused upon local needs. So it's not a question of one size fits all. The development of these legal frameworks need to reflect what the communities within which they're going to work are going to need. But by being established in advance, such frameworks will preclude the need for emergency powers, one would hope, and new legislation mid-disaster with the risk that brings. Hopefully also incorporate the views of those who might not be heard during a disaster response, particularly vulnerable groups who we felt often their views hadn't been taken into account, particularly with these swift legal changes that happened midway through the pandemic. In addition, as emphasized by Fino, and I'll just emphasize that myself, that the levels of regional cooperation in the Pacific around the COVID response was beyond that seen before in the region, and I think provides a platform for future Pacific-led responses to future disasters wherever they may come from. And I would hope that Pacific states will take the opportunity to take that forward and develop a true Pacific disaster response mechanism for the region. So to conclude, because I know there are many other people with many good things to comment on this report, that on the basis of our research and in line with the theme of Finao's statement that you heard before, we are of the view that the Pacific Island states examined and more broadly, assuming that our research is reflective of the broader Pacific Island approaches, should build on what was achieved in the COVID experience and consider the creation of more integrated legal frameworks and greater regional cooperation in the field of public health and disaster law in advance of the next disaster, which unfortunately will affect the region at some point in the not too distant future. Ka kite, thank you for your time.
Thank you. Thank you so much, Professor, for the hard work you and your team have put into throughout this journey of the study. We note how difficult it may be, given that most of the countries were either responding during the study period or engaged in preparedness actions. I would like to invite our third panelist, the Secretary General for the Samoa Red Cross, also the longest serving Secretary General in the movement, She will be discussing on the Samoa Red Cross auxiliary role and reflections on the Samoa experience in not only the current COVID-19 situation in Samoa, but also other outbreaks and epidemics leading up to it. Ms. Mawala, by profession, is a medical laboratory technologist. She is an executive member of the National Disaster Advisory Committee, National Health Program Advisory Committee, National Safe Blood Technical Committee, and National COVID-19 Coordination Committee. SG, the floor is yours.
Thank you very much for those kind words. I firstly want to acknowledge our International Federation of Red Cross, Red Crescent Society Disaster Law team for inviting me to speak in this important webinar. I just briefly want to enlarge on my previous role, as the medical laboratory technology, especially in the time when hepatitis B was endemic, in the Pacific. And I had the opportunity to be taken to Japan to train further into making vaccines, utilizing positive blood of our people, because it was quite a high incidence of positive hepatitis B. So it was something, when the COVID-19 came into the scene, it was a great reminder of that kind of work and how everything is going back into utilizing positive blood from those who have been infected with viruses to help others, to ensure and maintain their safety. So I'm very pleased to be part of this conversation. However, the past 2 years of the pandemic have challenged Pacific Island states, exposing outdated colonial era legislation that hinders attempts to deal quickly and comprehensively with the threats of the virus. We are used to dealing with natural disasters, just as many of our Pacific neighboring islands and national societies in this respect, in the region that faces huge logistical challenges in each disaster response. The advent of the pandemic, however, means that we are now confronted with a long-term hazard, imposing additional pressure on already stressed systems. We have cyclones, earthquakes, volcanic eruptions, and tsunamis, which can throw a population into turmoil when it's managing a COVID-19 outbreak or trying to prevent one. The situation here in Samoa has exploded in recent weeks, with 3,057 confirmed cases as of Tuesday, when we moved back to level 2. And we have about 2,700 people who are sick, which actually calculated to 1 in every 71 inhabitants. We have so far 3 deaths. Until now, most of the Pacific has remained relatively COVID-free, with the exception of islands such as Samoa, Fiji, Solomon Islands, PNG, and others. Regardless, we too have been dealing with public health measures, lockdown, closed borders, travel restrictions, and rising unemployment. And let us not forget about the harsh reality of climate change. This is all going on still today, whereas many countries outside the region are largely vaccinated and opening up. And these challenges highlight to all of us here in the Pacific the need to strengthen and integrate health laws and systems with our disaster preparedness and response approaches, as the consequences of outbreak remain unimaginable. The memory of the 1918 flu pandemic, when over 20% of our own country population died, remains very strong. And the Samoa measles outbreak in 2020 is a reminder of the consequences of diseases that are spreading in an unvaccinated, vulnerable population. We are experiencing evolving challenges around operations, particularly in our efforts to fulfill our mandates as auxiliary. to governments in the humanitarian field, and often they're first responders to the pandemic and other weather-related hazards simultaneously. The International Federation of Red Cross and Red Crescent Societies, the IFRC, has invested in decades of work in understanding and improving international and national disaster laws to address issues experienced over time. They have recently launched a report in Law and Disaster and Public Health Emergencies in the Pacific, looking at the intersection of public health emergencies and conventional disaster risk management approaches in the Pacific. And the report also outlines how the quality and speed of response to all aspects of COVID-19, the world is conditioned by and reflected in law and policy framework. And if these frameworks are not aligned, fail to speak to each other, and the systems they regulate cannot act rapidly and in unison, then a vital set and the system, the tools to mitigate the impact of the pandemic are blunted. Laws and policies have enabled states of emergencies or disasters to be declared, lockdowns to be imposed, and more recently, expedited vaccine approval. In many countries around the world and in the Pacific, old laws and contingency plans have been dusted off, sometimes proving outdated or inadequate, requiring the rapid development of new laws and regulations. The report found that although pandemics are defined as disasters in the disaster management law of every Pacific Island state or anywhere internationally, pandemic response has not traditionally been seen as the core business of the NDMO. In Samoa, our setup is characterized by a multi-hazard hybrid approach. We have disaster law frameworks based on laws established in the mid-2000s. All include health emergencies, but health events tend to be categorized separately. A lack of integration between health and disaster risk management frameworks means that we are also operating under different administrative frameworks. In Samoa, we have the National Action Plan in DRM, reflecting regional global frameworks, such as the Sendai Framework for DRR, Samoa Pathway, Paris Agreement, and so forth. It means that there's more harmonizing work that needs to be done in the near future to ensure alignment of our respective mandated roles in DRM and public health in emergency. However, the Samoa Disaster and Emergency Management Act 2007 sees the Ministry of Health designated as the key institution for health disasters and in disasters and emergencies. All response agencies are coordinated under the NDMO, who shall also provide facilities and staff for the NEOC. This is the NEOC. And this arrangement coordinates representatives from all responding agencies as liaison officers between the NEOC and our respective responding agencies. However, despite operating under our relatively modern disaster law framework, there is still reliance on old and at times pre-colonial laws around public health. By law, Samoa Red Cross Society is among the identified response agencies in the country. It has clear mandates in the National Disaster Management Plan, where it is a lead agency in first aid and tracing, and support agency in public health in emergency and other social determinants of health, and where lives are at stake in these situations, in accordance with our worldwide mission in alleviating human suffering wherever they are found. That's in events when a disaster is declared, it means the activation of the disaster response provisions of the NDMP or the National Disaster Management Plan by the chairperson of the National Disaster Council, which is our Prime Minister and the Cabinet, and in accordance with Section 19 of the Disaster Emergency and Management Act, which is our disaster law. In this context, Samoa Red Cross and all responding agencies must activate their response plans whilst maintaining respect for the standard, the SOE orders to ensure effective provisions of its mandated roles and responsibilities in saving lives. Samoa Red Cross has helped communities prepared for the worst, working with the most vulnerable households and communities, advising on isolation measures. Per our lessons learned from our Federation Fiji Red Cross colleagues, so that hospitals don't get overwhelmed like it did in Fiji and many other countries around the world. Logistics always proves a challenge in our disaster responses, and it's played out there too in a small way for us. We've had to negotiate tax exemptions for importation of relief and PPE supplies and vehicles into the country each time with the Ministry of Finance and the Ministry of Revenue through our disaster risk management structure. And such gaps between the disaster management plans, the disaster laws, and even the state of emergency provisions are common across the region. Every Pacific nation has experienced its own challenges, and sometimes we manage to find ingenious ways to help each other out, but we could always be doing it better. The Federation report makes a full list of recommendations, but here are a few that I think that could help across our island nations. First, the creation of clear statutory frameworks around public health emergencies, identified as such as part of a wide disaster law framework to address the regulatory needs of public health emergencies. Second, coherence between legal frameworks on disaster preparedness, response, and recovery across all hazards, including public health emergency. 3, explicit and improved integration of national disaster management offices in the public health emergency law framework. The establishment of regional international legal arrangements around logistical cooperation in national, regional, and global disaster leaders to long-term isolation of 4 Pacific Island states. And lastly, the further development and formalization of regionally led disaster and public health cooperation mechanisms under the Pacific Forum's POE declaration. More disaster law reforms can help us be better equipped and prepared to respond in this pandemic and any other multi-hazard of the future, for they are most certainly guaranteed. Thank you very much for your attention.
Thank you so much, SG. Just by listening to your interventions, I would like to convey our sincere appreciation to you and the entire Red Cross family in the Pacific, including our Fiji Red Cross Society, for the work that you guys do through your auxiliary role to support the governments and assist our vulnerable communities out there. Your support surely assists and complements government's humanitarian efforts in responding to and preparing for effective disaster response, especially during such challenging times as COVID-19. Our next panelist is Ms. Gabrielle Emery. Gabby was appointed to the position of UNDRR Head of Pacific Sub-Regional Office in January 2022 and is now based in Suva, Fiji. As the UNDRR Pacific representative, she oversees UNDRR's support to the Pacific Island countries and regional organizations. Prior to this appointment, Gabby was the head of the Disaster Law Program with the International Federation of Red Cross and Red Crescent in Asia Pacific. I would now like to invite Gabby to touch on the Bangkok principles, international best practices, and a little bit from her experience in coordinating the global law and public health emergencies, lessons from the COVID-19 pandemic report. The floor is yours, Gabby. Naka.
Vinaka and Bulavanaka, everyone, kia ora koutou. It's fantastic to be with you all today and obviously to be talking on an area that's so dear to my heart. So let me first of all congratulate Red Cross and IFRC for this fantastic work that they keep doing to making sure that these legal dimensions of DRR and emergencies and public health emergencies are kept kind of front and centre of our decision making and our efforts. And I also want to applaud the continued efforts of the Pacific Resilience Partnership to advocate for more integrated and joined up approaches for our resilience building. UNDRR, we fully endorse the recommendations coming out of this very timely report, really that legal frameworks for public health emergencies need to be strengthened and better integrated with disaster risk management frameworks at the local, at the national, and as we heard earlier, also at the regional level. This is not only in keeping with the Sendai framework for disaster risk reduction, but also in line with these Bangkok principles that you've heard mentioned in earlier discussions before. So the Bangkok principles for the implementation of the health aspects of the Sendai framework. And these Bangkok principles came about really in response to some of the learnings and reflections from the international community after the Ebola response. And there was a recognised need around needing to have more joined up approaches around health risk management and traditional DRR approaches. And in 2016, governments from across the world came together and other stakeholders to adopt a set of principles which encourage systematic cooperation, integration and coherence between disaster and health risk management. So it's really great to see that this research that's been conducted here in the Pacific is really teasing out and analysing how the Bangkok principles have been applied in legal and policy frameworks and also in practice in the Pacific. So it's a very, very interesting and timely piece of research. It also comes at a really critical time for the wider DRR community. As many of you know, this year is actually the midterm review of Sendai, which commenced in 2015. We have another 8 years left, maybe just over another 7 years left until 2030. So it's a really important opportunity where we're being asked to take stock and to reflect about, what is working well in terms of implementation of Sendai, and also, what we might need to accelerate or to do differently so we can, meet the commitments that have been made around more risk-informed development and management. So I would really encourage all of you, Pacific countries, governments, partners, regional organisations on this call to be looking at this research and, looking at the recommendations to see, how these can also be thought about in terms of your own national and local contexts, and, what recommendations can also be incorporated into your feedback into the midterm review process as well. So, and I think an area that the Pacific has been such a champion of is around integrated approaches and, globally very much leading the way on disasters and climate change. But, as we've seen witnessed by COVID, hazards, there are multiple types of hazards that we face globally, but particularly here in the Pacific. I think only the last 3 months we've had examples of geological hazards such as the volcano and the tsunami events recently in Tonga. We on a daily basis I think we're seeing the impacts of climate related hazards, both sudden onset and slow onset hazard events, as well as health risks. We only need to look at the situation we're all in at the moment and COVID, with also continued national lockdowns and travel restrictions across the region, as well as what Secretary General of Samoa was also talking about, the earlier history from Samoa in terms of different epidemics and outbreaks there as well. And that is not to mention other technological types of disasters and other types of hazards that we are all facing. So it's really clear that increasingly we need to take a multi-hazard risk approach in all of our efforts and our governance and our programming. So it's clear that countries can no longer plan their disaster risk reduction, preparedness and response efforts around a single hazard, but we really must consider how all of these multiple hazards are coming together and how we need to have joined up approaches on how to better prevent and respond to them. So again, critical, some of this finding from this research is coming out. So as we're looking to build back better and looking to build forward better after COVID, we need to ensure that we're collectively building on systems and approaches that are already working at both national and a local level. So we are avoiding duplication and duplication of efforts and resources. And I think, you know, some of those findings around better coordination that might be needed both across government and with non-government actors around health risk management and other DRR systems came out very strongly in this report. I also wanted to address the importance of the need of inclusivity, which is also comes out very strongly in this research as well. As we see in many types of disasters, we've all seen firsthand in COVID that certain groups in our society are disproportionately impacted by disasters and external shocks. So it's really, really vital that our risk management laws and our frameworks incorporate a human rights-based approach to our DRR efforts so that no one is left behind in a crisis or in our resilience building efforts. And I think that was another key takeaway I took from this piece of research as well. So in addition to thinking about how we can use some of this analysis and findings and recommendations in terms of some of that, you know, of how we're going to shape, you know, the next 7 years of Sendai in terms of the midterm review and also the framework for resilient development in the Pacific, I think it's also important to highlight that, you know, next month we have the Global Platform for Disaster Risk Reduction, the first global platform happening, you know, after 2 years of this pandemic. And the global platform will really, you know, have a backdrop around the integrated nature of risk and COVID-19. So again, I think there's, you know, a platform coming up, which will be an important, you know, arena where Pacific can voice some of these really critical findings that have been made in this research, as well as the Asia Pacific Ministerial Conference for Disaster Risk Reduction happening in Australia in September as well. So again, encourage participants here to see how those platforms can be used in terms of your advocacy. So in conclusion, I would really like to congratulate our partners from Red Cross and from across the Pacific Resilience Partnership once again on producing this significant report. And I think it's really going to benefit decision makers and stakeholders at all levels on how we can take forward this multi-hazard and inclusive approach to our risk management. So Vinaka, thank you so much.
Thank you so much, Gabby, for sharing on the Bangkok principles and highlighting the benefits for a multi-hazard approach to disaster and emergency response, including public health emergencies. Having a webinar to look at potential message for the Pacific to raise in the upcoming global platform on DRR and to contribute on the midterm review of the Sendai would definitely be a great next step. I would now like to invite Mr. Tusi Pinikaso of the Tuvalu NDMO, who is our second final speaker. He was the disaster coordinator for Tuvalu Red Cross, and he will be providing comments and insights on the Tuvalu experience in COVID-19, especially being one of the only countries in the world yet to get a COVID case. Mr. Tusi started off his career as a commercial pilot and also taught physics and maths. For the past 10 years, he worked in disaster management at Tuvalu Red Cross and the Tuvalu National Disaster Management. Mr. Tusi, the floor is yours.
Hi, talofa everybody. Thank you for inviting me. First of all, I'd like to thank IFRC. I still consider myself as part of the Red Cross family. And thanking all the authors and everybody that contributed to the Law, Disaster and Public Health Emergencies report here in the Pacific. The section on Tuvalu is a really good reflection on what happened here in Tuvalu. Prior to the onset of the COVID-19 pandemic, there was very limited health response capability in Tuvalu to deal with the health outbreak. And the document that they had prior to, I think, post 2019 was a Pacific Health Outbreak Manual, which they had here at the Ministry of Health, but hadn't been contextualized for Tuvalu yet. And some of these minor health outbreaks that they had, such as hepatitis, typhoid, and cholera outbreaks, were already proven to be challenging here in Tuvalu. Once COVID-19 started, it brought a lot of challenges, like was raised earlier in the report. The state of emergency that was declared, which meant closing of all borders, shutting out people and goods incoming to Tuvalu, basically provided a lot of problems. One, Tuvalu's heavily reliant on imports into the country. So issues like food, fuel, other cargoes such as building materials were very limited here in Tuvalu. Even here in Tuvalu, we still had the problem of people panic buying stuff. So the issue of cargo ships coming in Tuvalu was a major one. And so it provided a lot of challenges, especially at the leadership level. Are we going to completely shut off the borders, or how soon can we get the cargo ships to come in to Tuvalu? Already cargo ships come in like once or twice a month to Tuvalu. So with with further limitations, it provides even more problems on the ground here in Tuvalu. For the response in Tuvalu to COVID-19, however, it was more of a collaborative effort. Everybody in Tuvalu contributed. At the ministerial level, our ministers, especially the Minister for Communications, Justice and Foreign Affairs, Honorable Simon Kofe, they really advocated at the policy level, such as the creation of the PHPC, the Pacific Humanitarian Pathway for COVID-19, advocating for regional response, highlighting typical Pacific concepts such as the Falepili for regional cooperation. Here at the national level, a COVID-19 task force was created, comprising of CEOs or government secretaries from different government ministries, leaders from NGOs, private sectors. We had island leaders from Kaupule also participating at the National COVID-19 Task Force to make sure that the contingency plans that they developed were holistic and everybody had a say to it. So the contingencies that they did plan for, they planned for sectors such as food security, infrastructure, education, health. These were all incorporated into the contingency plan, which we call the Talaliki plan. At the island level, Kaupules or island councils, they developed their own SOPs to combat the COVID-19 from coming into their islands. We have been very fortunate that we still don't have a case yet. And Tuvalu has really learned from other Pacific Island nations, from their lessons learned of stuff that has happened there. In their countries. Here locally in country, the Ministry of Health has done a very good job with a huge support from Tuvalu Red Cross, doing outreach, not only in COVID-19, but for other disasters as well. We've had water shortages in the past year, and the Ministry of Health and Tuvalu Red Cross, including NDMO, have been very instrumental in ensuring that a lot of outreach has gone out to the outer islands. We've also had some strong winds happen here in Tuvalu, but not major, just very localized strong winds. So we do support and agree for multi-hazard approach, because we need to see people collaborate and work together, not only at certain levels, but everybody has to work together. As mentioned before by SG Tala, Director Varsity and Finau, coordination is very important. We do support a national framework incorporating all disasters in a multi-hazard approach, taking into account regional frameworks such as the Bangkok and Sendai frameworks, to make sure that there's an overarching framework that will support all preparedness and response work here at the national level. Like Director Varsity mentioned before, if we have everybody's working in one framework, it will be really good. Just like say in the event of say a cyclone here in Tuvalu, all of the different departments, they all support NDMO. So a little bit something for the Ministry of Health, because at the moment now Ministry of Health is pretty much working by themselves with Red Cross. However, with the support of the National COVID-19 Task Force. Another priority for us here in Tuvalu is a review of the aging, disaster and public health legislation as highlighted in the report. COVID-19 really exposed the lack of the frameworks and legislation here in Tuvalu for major response. At the regional level, we do agree that a framework for regional response to be improved, to be developed, as Tuvalu really benefited from that. Countries such as Fiji, as the gateway to Tuvalu, they provided a major buffer for Tuvalu. All the actions that Fiji took benefited Tuvalu in this way. Before passengers can come to Tuvalu, they have to go to Fiji first. So all the actions that Fiji took, it benefited Tuvalu in such a way that we provided an extra, Fiji provided an extra layer of security for Tuvalu. So by the time that the passengers actually flew to Tuvalu, they had already been screened and been through the whole lot of quarantine that Fiji provided. And we think that the regional response should really reflect this, on how countries like Fiji can contribute to further strengthening of regional frameworks. I think from Tuvalu, we really love the report and we congratulate IFRC for creating the report. And we also like to thank our PRP for including us in this webinar today. Afdailas.
Vinakavakalevutusi, thank you so much for sharing your experiences and insights. Keeping track of the time, I think it's opportune time for us to pose key questions to our panelists. Before we give the floor to our key speaker, Ms. Sai, to officially launch the report. Ladies and gentlemen, please allow me to pose 2 questions to our panelists, and I'll kindly ask them to answer this in order of the speakers that had presented. So we'll have Mr. Hopkins first, and then followed by SG for Samoa Red Cross. Then we'll have Gabby share her comments on these questions. And then Tusi, we'll invite you also to share your comments on these 2 questions. So the first question that we'd like our panelists to share their views on is, what is the one key action that we need to focus on to strengthen disaster risk governance arrangements for increasingly complex scenarios? That's first question. And the second question is, what messages from the Pacific do you want us to take to the global platform for DRR that is scheduled for May this year? So these are the 2 questions, and now I would like to invite our first speaker, Mr. Hopkins, to share his views on these questions, please.
Thank you. Kia ora. Thanks for the questions. So in terms of one, I'm sort of repeating myself here a little bit, but my suggestion would be the one thing to focus on is to creating a single, or as far as one can, an integrated, simple legal framework that provides tools for the wide-ranging response that you're going to need for different types of hazards. So rather than just talking all hazards, which of course we do, but making that clearly part of your legal framework and incorporating health within that. But it also has to be locally tailored to the requirements of your community and the government in which you're working. I thought it was interesting to hear from Tuvalu, where you had a very different approach, which works in Tuvalu and might not work in a different scenario. And whatever you introduce, it has to have checks and balances so that we avoid the need for these long-term emergency powers, or the need to introduce mid-term disaster legislation, which has been a common feature, not just in the Pacific, but everywhere, which often leads to poor law and law that possibly gives too much power or doesn't take into account the views of vulnerable communities or other groups that should be listened to. It's very different to get those voices in the middle of an emergency. So that would be my general view. I would also be cheeky and say the other issue is to push on with regional cooperation mechanisms, because there's no doubt that the Pacific as a region can respond better if it works together. It's hard to given the distances involved, but I think the success of the COVID regional responses show that that can be done. So sorry, I gave you 2 action points, not 1. The second question that you asked about what messages from the Pacific for the global platform, I think taking the Pacific experiences around integration and the need for NDMOs to be at the heart or even leading disaster management approaches. I think this happened more in the Pacific than we saw in other parts of the world, even if it was informally. NDMOs seem to have taken a bigger role. And I think that is the way to go. And I think to take those lessons to the global community would be useful. To emphasizing the fact that particularly in the Pacific, but I think in most of the world, the public health emergencies these days are as much about economic and social consequences, and the same is true of almost all hazard. It's not about the hazard, it's about the consequence, and those consequences are going to be much broader than, for example, as we saw in health, than just health. And thus, while you need experts to provide the key expertise around the hazards, you need to have those with expertise and experience around the practicalities of disaster response to lead in those areas and have the tools to deliver them. So we heard about the importance of logistics. It's almost, we know this in natural hazards, that the logistics are important, but they're important across the board, and you need legal frameworks that recognize that and probably empower NDMOs to have that role clearly. So that would be my thoughts. Thank you, Chair.
Thank you so much, Professor, for sharing your insights. Indeed, very helpful for the team to put forward for the global platform. Now I would give the floor to Ms. Tala Maula, SG for Samoa Red Cross, to share her views.
Yeah, thank you. The focus that I suggest should be highly considered is our communities. We believe that the translation of all of this technical information, the laws and policies, needs to be filtered down for the sake of our communities, because these are the people that react to any disaster or any health emergency. And we have seen that in the early stages of our work in the prevention and preparedness for this COVID-19 pandemic. People who are living in water-stressed area of the country don't really have water, to do the hand washing and all that we're trying to reach out for. And in the end, they had to do what they do best, in the situation that they're in. And the matter of washing hands, is most critical, or distancing and wearing masks. And these are some of the technical messaging that we really need to ensure our community are well aware about, as well as all the viruses and what is going on around the country as well as the world. We've been doing that in our disaster risk management and climate change work. And now that the real public health emergency is within us, it's a matter of going back to the community and ensure that they are well versed with what we're saying, so that we can expect them to react and respond more effectively, when disasters are really critical, to ensure that lives can be saved. For the second question, the Federation has been doing a lot of study and work on IDRL, international out, through our Pacific Island Forum meetings with our leaders in the Pacific. And we'd like that to be taken up again, and even globally, so that all the countries and governments whom Red Cross are auxiliary partners with ensure that this area should be considered well, so that in disasters there shouldn't be any delayed response to the very people who are in need of what we are providing for them, due to the red tapes and everything that is happening, especially in the international assistance that are coming into our small island nations and the countries. So I recommend that the international disaster response law needs to be taken up again, so that all our nations and governments, should be complied and obligate to ensure that these pieces of law can be considered well for the sake of our countries and the whole world in the next disasters to come. Thank you very much.
Thank you so much, SG, for sharing your views. Indeed, the message was loud and clear, putting communities at the heart of our planning and everything. Now I would like to ask Gabby to share her views, and then Tusi to share his views as well.
Great. So maybe I'll tackle the first question first. So I would say a hazard, a health hazard or a natural hazard event doesn't necessarily need to become a disaster. There's exposure and vulnerability that play out for anything to become a disaster. And in a way, that's good news, because it means there's things that we can do about that. And it means that having effective laws and policies and governance frameworks are a key thing here. But, I think in terms of when we look at that, we need to kind of have some key things in mind, that laws and policies can't be just response driven. We still see a very reactive approach to many of the disasters and public health emergency laws. They really have to embody prevention and how to really enable risk reduction approaches to prevent these hazards from becoming disasters in the first place. I think in the Pacific, there's still a level of fragmentation that continues between different national ministries, and really we need to move to more joined up approaches. I know it's not easy with bureaucracies and things, but how we really kind of use these governance frameworks to ensure mandated responsibility and good coordination structures is key. The third one, I know I was only meant to give one, but I'm going to give more. Governance, it's not just about governments. I think we've seen in COVID, to have the reach that's needed, and that there's not just one sector of society that's impacted. You really need to have very clear roles and responsibilities for all sectors of society, and for that awareness at the community level. And I'm just going to, the fourth one, it will be about implementation. We can't stop this law and policy making and kind of leave it at nice policies at the national level. We need to ensure there's investment, there's support, there's capacities that really reaching down at the local and the community levels as well. In terms of messages for the global platform, probably not my area to say or speak on behalf of the Pacific, but I certainly think there's a lot of really great and dynamic examples coming from the Pacific, particularly around these integrated approaches around climate and disasters, you know, and some learnings of how maybe health factors can also be taken forward in terms of this integrated approaches. So yeah, we look forward to hearing what the Pacific has to say over in Bali next month. Thanks.
Thank you so much, Gabby. We'll now listen from Mr. Tusi.
Hi, guys. I think like a good approach for Tuvalu for the way forward would be something a little bit similar to what the Secretary General from Samoa referred to, something as a holistic approach taken by all stakeholders in Tuvalu and ensuring that it reaches down to the community level, because the people that we're supporting at the end of the day are people from the community. And if they are not aware of the current frameworks that are in operation, they won't be able to use it. So something where with stakeholders at the national level, they work together to develop like an overarching framework for all disasters, including health responses here in Tuvalu, and making sure that it reaches, the outreach reaches down to all communities in Tuvalu, down to the grassroots level. Something where, like a framework that everybody will understand. I think that would be the best approach here in Tuvalu at the national level. Thank you.
Thank you so much, Tusi. We do note that there are some very interesting questions raised in the chat box. I hope the Secretariat is taking note of that. If time permits, we'll give the floor to the panelists to answer those questions. However, moving forward, I would now like to invite our key speaker, Ms. Sai, who is the IFRC Partnerships and Program Manager. She'll be giving her remarks with regards to the launch of the report. Ms. Sai, the floor is yours. Naka.
Dear country members, representatives from local and private sectors and the non-governmental organizations, crop agencies, regional and international colleagues, and participants from across the Blue Pacific. It is my pleasure today to greet you and to deliver the remarks for launching of the Pacific Disasters and Public Health Emergencies in the Pacific Report. As highlighted by our speakers today, law and policy underpin all aspects of disaster response, including COVID-19. Laws enable states of emergency or disaster to be declared, lockdowns to be imposed, and more recently, expedited vaccine approval. During the COVID pandemic, all laws, policies, and contingency plans were dusted off, often proving to be outdated or inadequate, requiring the rapid development of new laws, including amendments or regulations. That never have seen so many laws being made in so many countries in respect of one event in such a short time. This is not only in the Pacific, but internationally. Domestic legal preparedness for disasters, which include public health emergencies, keep communities safe and save lives. Law and policy form the foundation of disaster risk management, regulating how, when, and by whom emergency response activities are carried out. Without a strong legal base, preparedness and response activities can be uncoordinated and ineffective, often delaying urgent help to the people that need it most. Initial findings from the Global Report on Law and Pacific Health Emergencies, lessons from the COVID-19 pandemic, show an overall lack of strong legislation for public health emergencies, leading to inadequate legal preparedness for COVID-19. As you have heard from our researchers, the Pacific Disasters and Public Health Emergencies in the Pacific found that from 8 Pacific countries whose laws were examined, the Pacific fared better than most of the world. I want to touch again on some of the key findings in that the majority of the states examined led their COVID response unit using frameworks based on public health emergency legislation, but with disaster risk management, state of emergency, or state of disaster laws, supporting and supplementing that legislation to a lesser or greater extent. The hybrid framework allowed states to adapt to the very different requirements of the global pandemic. However, it is also important to note that the study found that even the health laws are to be practiced strictly. It may result in separate and parallel structure for biological hazards, health risks, in contrast to hazards that are geological or meteorological in nature. Another key finding I wanted to highlight is how the regional framework played a key role in the Pacific response through the Pacific Humanitarian Pathway, COVID-19, showing the potential for more formalized regional approaches to coordination for disasters and emergencies in the region. Some of the recommendations that stand out are the need for greater consideration of the role and protection of vulnerable groups and individuals within Pacific disaster law frameworks, particularly in relation to long-term disasters such as public health emergencies. Coherence between legal frameworks on disaster preparedness, response and recovery across all hazards, including public health emergencies. And lastly, the creation of legal frameworks and thereby strengthening risk governance to address long, drawn-out disasters, including improved integration of NDMOs into the public health emergency law framework. At the regional level, the key recommendations are to, one, establish a regional and international legal arrangement around logistical cooperation in national, regional, and global disasters, which may lead to long-term isolation for the Pacific Island states and territories. And lastly, the further development and formalization of a regionally led disaster and public health cooperation mechanism under the Pacific Forum's Boe Declaration. I feel that our Pacific traditional communal values play a huge part in our COVID response, being strong despite dated and sometimes conflicting legislation. This communal sense of belonging and being part of the Pacific Blue also led to the success of the Pacific Humanitarian Pathway for COVID-19. However, given the Pacific's added vulnerability to natural disasters and the impacts of climate change, urgent action must be taken to strengthen domestic and regional legal and policy frameworks for public health emergencies with a view for a multiple hazard integrated approach. The COVID-19 pandemic is an opportunity to review law and policy for public health emergencies and consider what improvements need to be made. Public health emergencies are not new and will continue to occur alongside the usual natural disasters that we prepare for year in and year out, including cyclones, droughts, tsunamis, and volcanic eruptions. Governments, lawmakers, donors, and the humanitarian development sectors must act now to strengthen legal preparedness for public health emergencies and look for opportunities to integrate approaches with other emergency prepared systems. The report is only the beginning of our journey. The Technical Working Group on Risk Governance will collaborate with its members, including PIPS, SPC, PILON, IFRC, UNDRR, and UN OCHA, donors and partners to provide support to Pacific governments to develop and implement law and policies for multi-hazard responses, including public health emergencies, climate and natural disasters.
Vinakavakalevu Sai for those wonderful remarks for the launch of the report. Ladies and gentlemen, I think that brings us to the end of our webinar today. I must sincerely appreciate the time and effort put forward by our panelists and their contribution towards strengthening of risk governance in the Pacific. A big Vinakavakalevu also goes out to our viewers for logging in today and joining the webinar. Thank you so much. I do know that some of the questions we were not able to answer in the webinar live today. However, Secretariat kindly requesting if you could forward those questions to the respective panelists to get their response and forward it to the person who has raised the question in due course. Without any further ado, as on behalf of the Deputy Chair for the Technical Working Group for Risk Governance, Ms. Vasiti Soko, I would like to reiterate that this is not the beginning for strengthening of local, national, and regional risk governance in the Pacific. So please continue to check the PRP Facebook page and watch the space for upcoming events and webinars such as this. Binaka Wakalevu, and thank you.